Hi, I'm Kathy Smith, and welcome to On Health, the Art of Living, where I bring you the latest information on how to live a vibrant, more passion-driven life. So on today's show, Dr. Kathryn Schmitz is talking about her book, Moving Through Cancer. Her empowering message will not only resonate with anyone who's been diagnosed with cancer, but also their family and their loved ones. So after 26 years researching the benefits of exercise for cancer patients, Kathryn and her wife, Sarah, experienced firsthand the restorative power of exercise as part of cancer treatment. You see, in 2016, Sarah was diagnosed with stage 3 squamous cell carcinoma, and she's currently NED, which means no evidence of disease. So Moving Through Cancer is inspired by Kathryn's professional and personal experience with cancer, providing both inspiration and guidance to patients facing their own cancer journeys. This is just such a great personal narrative that helps answer that all too common question asked by cancer patients, which is, Doctor, what can I do to make myself feel better? So Kathryn's many accomplishments include holding the position of Distinguished Professor of Public Health Services at Penn State's College of Medicine and Penn State Cancer Institute. She's also the past president of the American College of Sports Medicine. So this is an amazing book. It's a must-read book, Moving Through Cancer, because it presents the science of using exercise, first of all, as a tool to help reduce the risk of developing some of the most common types of cancers. But then it's also a groundbreaking book about how do you take yourself from diagnosis and going through that crushing feeling once you get the diagnosis to thriving using strength training and cardiovascular exercise to improve your mental and physical health before, during, and after the cancer diagnosis and treatment. So with that being said, and with having this wonderful woman on the show, let me welcome her. Kathryn, welcome to the show.
Thank you so much. It is my honor to get to talk to you.
Oh, I'm so excited. I mean, when I heard about your research from Dr. Bob Salas and heard what you were doing, I just dove into it because, again, we all, if we haven't experienced cancer personally, then we know people, we have family members, we have friends, and it's just remarkable what the impact of exercise, and I don't think most people know about it. When I started talking to other friends, they're sort of looking at me kind of quizzically. So before we jump in though, what prompted you to get involved with this research 26 years ago?
Okay, so I was a postdoc at the University of Minnesota and thought I was going to have a career looking at exercise and obesity prevention, diabetes, heart disease. And, I was a little concerned with the fact that it really felt to me like I was going to be doing incremental science, just sort of one step and then the next step. All the big leaps forward in the field of exercise and cardiovascular disease had already been made. We already knew that exercise was good for heart attacks, right? So I had a conversation with a faculty mentor who asked me if I had ever considered working in the area of exercise and cancer. And I said, I can spell cancer. So I spent about 3 weeks focusing on exercise and cancer. And there wasn't a whole lot to read. The field was really, nascent at that point. And there was one paper in particular by Ann McTiernan. And this paper was a call to action. And it was a call to action for people just like me with just my kind of training. It basically said, if you are trained to work in exercise and cardiovascular disease and diabetes and metabolic disease, we need you over here in cancer. Please think of, switching tracks and focusing on cancer. And I emailed her and she emailed back and we met at a scientific conference and she became a close mentor for the earlier part of my career and remains a mentor today. And I started working in cancer. I wrote my first grant to the Susan Komen Foundation and I got the grant and I never looked back.
Well, it's interesting because you hear when you get a cancer diagnosis, most of the time you're told the best remedy is rest, and more rest. And you're kind of trying to change that culture, or you are changing that to let's move. It seems counterintuitive to like most people, as we were talking about, but you really believe, and the science is showing, not that you just believe, but the science is showing that once diagnosed, that exercising actually changes the trajectory of your cancer. So I want to just, for all the doubting Thomases out there, and for all the people are going, no, tell me what, can you just start where you want to dive in, just talking about what you've learned through your research?
Sure. So I think that there's actually a little bit of an analogy that I'd like to draw first in order for people to understand the kinds of changes that can happen over time because of science. So back in the 1950s, Dwight Eisenhower was sitting president and he had a heart attack. And his cardiologist was sharply criticized for getting him out of bed so quickly, 3 weeks after his heart attack. And today we laugh at that idea because we know that we get heart attack, people who've had a heart attack out of bed within 24 hours. We know that we get them exercising. If you ask the average person with an 8th grade education in this country, should you exercise after a heart attack? They'll say yes. There's been an enormous paradigm shift since the 1950s because of the science, but also because of advocacy on the part of organizations like the American College of Sports Medicine, the American College of Cardiology, the American Heart Association. We now understand and we connect exercise with heart disease. We know that exercise, the average person knows that exercise is good for somebody who has had a heart attack and has heart disease. Well, we need a similar paradigm shift. We have the evidence base. This is not something that I cooked up in my garage this weekend. We have 15,000 peer-reviewed scientific articles in the peer-reviewed literature that tell us that exercise is helpful for people living with and beyond cancer. And so we need a paradigm shift. And we know that exercise is not only good for all of these symptoms that people have as they're going through their cancer, we also know that exercise is preventive from the development of cancer in the first place. And we know that for 3 very common cancers, colon, breast, and prostate cancer, that exercise is powerful medicine for preventing recurrence and death for people who have had a diagnosis of those cancers. So there is a preponderance of evidence that tells us that people living with and beyond cancer should be physically active. And yet we have a culture that tells them to rest, take it easy, don't push yourself. So it's time for a paradigm shift. That's why I wrote the book.
Well, I want to go a couple different directions, but before I do, completely relate to the cardiovascular side of this. I ran my first marathon in 75, but the way that I got into that was Dr. Ken Cooper and all of his research on aerobic exercise and heart disease. And I have heart disease in my family, but most importantly, there would happen to be, when I was at the University of Hawaii, there happened to be a doctor, Dr. Scaff, who was taking like 26 heart patients, people that had episodes or whatever, and then training them to run a marathon. Now you can imagine, even in the early 70s, this was like, if you had a heart attack, you do not walk up a flight of stairs. You don't have sex. You don't look at a good looking, man or woman. You just like keep everything very calm. So this was really one of these, like a real game changer. And I would go on the weekends and run with these guys, and eventually ran a marathon of 75. So kind of just supporting what a difference now you have, to where the science is today. But getting back to prevention, I want to get into prevention, and not only exercise, but also a little diet. Before we jump into that though, you had all this research going on. And then you had this personal situation with your wife, Sarah. Do you mind jumping in and telling us about what happened and how that changed your perspective, not only from the professional, but now coming from the personal?
Yeah, I don't mind talking about that at all. Sarah was diagnosed with a stage 3 squamous cell carcinoma in a very rare location inside her nostril. We still don't know what caused it, but it was stage 3, so it was fairly far advanced. So she had to have her entire nose removed, a complete rhinectomy, the name of that surgery. And she also underwent combined chemo and radiation, which is the toughest version of cancer treatment you can ask for. And it was in the process of her going through that I learned some powerful lessons about how to apply the results of the research that I've been doing at that point for well over a decade. Before that, I think that I had this kind of sense of, well, people should do this. They should just do it. Just exercise. Just go do it. And it's important. I know what the benefits are. You should just go do it. And then the lived experience of working with Sarah really had me, sort of rocked back on my heels of the reality of just how difficult what she went through was, and that I came up with the concept of just bad days. You have bad days as you're going through treatment, and if you have a bad day, then you do what you can, and you just keep moving. More movement is better. And so the way that I approach cancer patients and survivors now is more human, more humane, I think. There is, certainly an evidence base behind what I'm recommending, but I think that there's a recognition or a need for a recognition of the person that's sitting in front of you and what they're actually experiencing. And we can't push somebody past what is humanly possible as they're going through their treatment. So I'm glad to tell you that there has been some really lovely research out of Canada that has talked about the importance of exercising during treatment and the recognition of kind of a sawtooth approach of sort of the symptoms get worse and then they abate and they get better, but they never quite come back to baseline, and then they get worse a little more. And exercise can kind of shift that whole equation so that somebody can recover more quickly after they're done with their treatment, if they're physically active as they go through treatment.
Yeah, which as I was reading about that, it's quite miraculous. And yet we know that whether you have cancer or no cancer, if you're feeling fatigued, and we all have that experience of feeling fatigued where it's, oh, I can't do my workout today, or I can't get to the gym, or I just don't have the energy. So and now you add on to that cancer treatments and how you hear that is one of the common symptoms that you just get so fatigued. So it almost seems well, maybe let me put it another way. How do you blend compassion with what has to be done, and how do you do it the way that you don't look like an asshole? And there are no other way to say it, but I mean, it's like, get out of bed and exercise now.
Yeah. So the recommendation that I have heard from so many exercise oncology professionals is that it's counterintuitive to exercise when you feel that fatigued, but we know from the evidence base that exercise is the number one treatment for cancer-related fatigue. It is better than any pharmacologic agent on the market for cancer-related fatigue. And so the recommendation is, if you don't feel like it, get up anyway and do 10 minutes. And if you don't feel worse after 10 minutes, then you keep going. If after 10 minutes you're like, nah, no, this is not happening today, then you've done 10 minutes, and that's great. If you get up and you can only do 5 minutes, and that's all that you can handle today, you've done 5 minutes. So that's the recommendation, is that you try. Even if you don't feel like it, you try. And if you feel worse by virtue of trying, then that's a bad day. You don't do anymore. The other thing that I think ends up happening, and I think that this is crucial for your listeners to hear, is that there is the tendency during the period of treatment to just have kind of a get out of jail free card for any kind of movement and any kind of exercise. And the problem with that is that we know that people who do nothing during their treatment come out of treatment in much worse shape than people who continue to exercise during their treatment. So what do you do with that? How do you balance that? The way that you put that together is you recognize that you will have bad days. So let me give you an example. Let's say that you have chemotherapy every 2 weeks, right? So day 1 is the day that you have your chemo. It's very common for people to feel pretty pukey, pretty not so great for day 2, day 3, but by day 4, they're probably feeling better. Well, you've got day 4 to day 14 to exercise when you're feeling much better. And then maybe you don't exercise for a few days again once you get your chemo again in the next cycle. So, the way that it works is you start to recognize the pattern as you go through your treatment as to either what days work for you for exercise in the cycles of chemotherapy or what time of day. It could be that exercise works best in the morning. It could be that it works best before 2 o'clock in the afternoon. Most people find that their energy wanes by the evening if they're currently going through treatment. So usually it'll be earlier in the day when it will work.
Makes sense. Well, that leads us into then dosage. I mean, how much are the recommendations? I know in the book you lay out a course, which I appreciate, with strength training and cardiovascular training. But why don't we talk about both approaches to movement? And I know some of the approaches help with perhaps the anxiety or the fatigue or mental depression, and maintaining muscle mass, obviously. And then others are more lung. Do I have this right, that one of the things about cardiovascular exercise is that it helps get the medicine spread throughout your body a little better, or am I making that up?
Yep. So one of the hypotheses that comes out of the animal research that we have in exercise oncology is that by doing cardiovascular exercise, we increase shear stress on blood vessels in the body. And there is some animal research to show that the shear stress affects the vessels around tumors. And that has importance because usually tumors are very poorly vascularized. There's very poor blood vessel structure around tumors. And so if you improve that blood vessel structure or architecture around the tumor, then the chemotherapy can be better delivered to the tumor and the tumor shrink more quickly. So some absolutely brilliant work on that topic coming out of MD Anderson. So yes, we believe that cardiovascular exercise actually may potentiate the ability of the body to receive and use chemotherapy. So that's really important. But you've asked another, I think, crucial question, and that is, what's your why? And I think that that's really important for patients to ask themselves. If your why is, I don't want to feel so fatigued, then the types of exercise that you're going to focus on could be aerobic or resistance exercise. If your why is anxiety and depression, then it's aerobic exercise. That's really, really the focus. If your why is physical function, and you're really interested in maintaining your muscle mass, then the type of exercise you want to focus on is resistance exercise. So what is it that you really care about? What is it that you're really looking to get out of the exercising during and after your treatment? That guides you. And within the book, we outline which types of exercise are more important for which types of outcomes. And I think that it's important to say that because I think that exercise is medicine, right? And so if exercise is medicine, then we need to dose it like a medicine. And we don't just say, go get some chemotherapy. We don't say that. We say, I'm going to give you adriamycin. I'm going to dose it according to this, milligrams per kilogram of your body weight. We're going to give it to you in this specific timing. So what they're doing is they're looking at frequency, intensity, the time that they're giving you the chemotherapy, as well as the type of chemotherapy. We can do the same thing using the FIT principle with exercise, frequency, intensity, time, and type, in order to address specific outcomes for cancer patients and survivors.
Well, it seems like there's a bit of, going back to the question before, about if you're feeling fatigued, there's a bit of this periodization that could also happen and just meaning that then you can also pick and choose throughout the course of the week or throughout the course of your between your chemo treatments, certain days that perhaps right after uh, a walk,
Yeah.
a walk, maybe, just getting outdoors. By the third day, it might be a little bit more HIIT training, a little faster walk, which you can maybe add some strength training in. But I would imagine that you can that you can start to see the course of the 2 weeks and your pattern, and maybe create like a little workout schedule. And you mentioned about journaling, that you think logging, or I think you call it logging or journaling, is really important.
Yeah.
Can you explain a little bit why?
Yeah. So I actually think that the logging is the secret sauce of the book. And the reason for that is that you know, I think that the exercise combined with the logging helps patients to understand what's happening with their bodies in ways that are not available to them if they're not moving on a regular basis. So if we use the analogy of somebody who is an elite athlete, that person goes out for a run and they know how their body is on that day, right? And if somebody goes out for a run and they haven't been out for a run for 12 years, it's all unfamiliar, and the analogy is, another analogy is, how often do you drive your car? You drive your car every day. If there's a new squeak or a new rattle, you know it, right?
Mhm.
And then you can go to the mechanic and say, there's a new squeak or rattle. It's not normal, right? So the analogy is somebody who's exercising on a regular basis knows how they feel and they know how their body feels. And if they are logging and they're saying, this, was hard at a level of 4 out of 10 today, 4 out of 10 the next day, and then the next day it's an 8 out of 10, and you're wondering, what in the world is going on? Why is this so hard today? And then things just start being really hard for reasons you don't understand. You can go back to your doctor and say, something's going on. Something different is happening to my body. This is a new squeak or rattle, if you will, a new symptom. And physicians, trust me, if somebody who is, I'll give you a great analogy. Keegan Randall is a U.S. Olympian, gold medalist, cross-country skier. She had stage 3 breast cancer. And, you gotta know that she was training while she was going through a breast cancer. And if she had a symptom and it was like a weird symptom and something was different, her doctors were listening to her because she knew her body and she knew what was happening with her body. And so what I'm suggesting is that the average person, if they start exercising as they're going through their cancer treatment, and if they have a change in what they feel is going on with their body while they're doing their exercise, that can then be reported back to the physicians, and that can help the physicians to know how to help the patient.
Yeah. So you just armed with that extra information,
Uh,
you can just have a better dialogue, as opposed to there's this joke about Dr. Google, I'm sure you've heard, but so many people just like, their doctors sometimes be, let's Google this.
Yep.
And which is good sometimes, I guess.
Well,
You get a lot of good information, but
it also, if you have a new squeak and rattle and you're not exercising on a regular basis and there's some new symptom, you might, panic and think, what does this mean? What does this mean? And if you're exercising on a regular basis, you come to know your body, you come to understand what various aches and pains are. And, then if something's new, then you really can trust that you've got some helpful information for your physician.
so you think that exercise is so powerful, as you've mentioned in your book, and you talked about today, that you're wanting to make it the fourth pillar. I think that's
Yeah.
how you stated, of treatment. So combining that with chemo, radiation, surgery, and then exercise, and you're hoping that this becomes just part of every cancer patient's treatment at one point. Where is it now, and where do you see it going, and how can we support that effort?
Right. So where it is now is that just recently, the American Society of Clinical Oncology released a new clinical guideline stating that oncologists should be referring their patients to exercise during treatment for all of the symptom outcomes that we already had recommended were helpful from the American College of Sports Medicine guidelines. So there's, basically we have guideline upon guideline upon guideline In addition to that, I'm happy to say that I have worked for the past 2 years with the National Accreditation Program for Breast Centers on their standards, and the new standards that will be coming out as of 2023, 2024 require that breast centers refer their patients to exercise during chemotherapy and in the survivorship phase. So we have some clinical guidelines that are out there, but there's also some standards that are, requirements of accredited centers that they send their patients to some kind of programming. There's also the Moving Through Cancer Task Force from the American College of Sports Medicine, which lives under the auspices of the Exercises Medicine program from ACSM. And we have a website that includes an exercise directory that includes 1,800 different programs from around the world. So people can go to that website and find an exercise oncology professional or program near them. And there are a lot of online programs for people who don't find something near them. So there's sort of a burgeoning list of programs that are out there. But when it comes to the average person at the average cancer center across the United States, only about 15 to 20% of patients are reporting that their oncologist is actually talking to them about physical activity during and after their cancer treatment. And so we have to do better with educating oncologists so that we make it easier for them to be able to talk to their patients about physical activity. And we need to train way more fitness professionals to work with this population. Right now, there's actually a small number of fitness professionals who are specifically trained to work with oncology patients. So that's a major initiative of the American College of Sports Medicine at this point, is to increase that by partnering with an organization from the UK called Can Rehab to train more exercise professionals to work with this population. So we're also, the Moving Through Cancer Task Force has written a booklet that is intended to be an educational booklet for patients, caregivers, and clinicians. And I'm happy to say that AbbVie, the pharmaceutical company, has funded us to try to disseminate that booklet across the United States. So we'll be trying to get that word out. But, for the average patient, for the average cancer center, there is a patchwork of likelihood that somebody is going to be connected to high quality exercise oncology programming. And we have to keep the drumbeat up. We have to increase the number of exercise professionals available, train the oncologists, and increase the amount of programming that's out there. So it's a big lift right now. There's a lot to do. I'm busy.
Well, anything I can do, and we can talk afterwards, to support your efforts, because I went to the website and looked at all the resources. But as we know, it's one of these things that it can start there. There's got to be groundswells that start in different areas, including the consumer, the friend, the customer, the person out here who has a friend who's just been diagnosed, or maybe they've gotten a diagnosis and now they go in with armed again with a little bit more information. So maybe they can ask some questions, and maybe the questioning then prompts the healthcare provider to get more involved. But I do see that I actually even know, I remember back when exercise is medicine came on the spotlight, it was started to be spotlighted, and at the conventions, the IDEA convention, at these different conventions, and even that took a while to catch on to what does that mean? How potent is this, dose of exercise? And when I would give my speeches, I would get the little, if a doctor told you, and we've all heard this before, but I would have a little bottle, a prescription bottle. If a doctor told you there's a pill in here that can reduce anxiety, the list of 25 things, you jump on that pill right away. Okay, I got the pill. Let's start exercising. And that we've been giving that message, as you said, for so long, for cardiovascular disease, for even diabetes, but we haven't heard that message that much for cancer. I'm sure it's out there, but even myself, who here is checking into and reading all the time, it's not what you hear cancer patients talking about that much.
I have this dream of something that could happen, because I think it has to do with, the zeitgeist, the cultural paradigm shift.
Right.
If you think about it, think about the last time you saw someone with cancer in a TV show or in a movie, and think about what they looked like and how they were portrayed. They were portrayed likely with a scarf on or bald, very waxy, IV in the arm, sitting with a blanket over their legs, right? They were pictured near death, right? And that is not what cancer looks like. Go look in cancer centers. Go walk around cancer centers. That is not what cancer looks like. It's a small proportion of cancer, very small proportion of cancer, but a lot of people are living with and beyond cancer now. And so I have this dream of connecting with, there's an organization at the University of Southern California that is about accuracy in the media. And they've done this remarkable work with television shows doing a better job of depicting the truth of what happens with CPR. Because CPR was depicted in TV shows and movies as always working. And the truth is, it doesn't always work, right? So they've worked with television writers to get them to depict it accurately, right? Well, what if we worked with some television writers that had a storyline that included cancer and got them to depict a cancer patient walking, exercising, moving?
Brilliant. Now I got chills when you were talking about that, because you're absolutely right. It's like you never see that kind of image on television. It's and it would be so powerful to see somebody in the throes and diagnosis. And even in your book where you say when you get the diagnosis, and even if you your chemotherapy is going to start or whatever therapy in a month. I mean, that golden 30 days or whatever to start to build and strengthen and build up your strength so you can take the hit of a lot of what chemo and radiation does. I mean, it's very powerful. And to see somebody get that diagnosis and then go out for their run and say, okay, we got this. We're going to tackle this. We're going to bring in all the forces, everything I can do. And we'll have to have another conversation. I don't know. And we can't get into this show because we're winding down now, but I'm sure there's a whole nutritional element here.
Oh, absolutely. Absolutely. However, I do want you to note that the ASCO guideline that came out, the American Society of Clinical Oncology guideline that came out just in May about exercise and nutrition during cancer treatment, concluded that there was no evidence that any particular way of eating during chemotherapy made any difference.
Okay.
So you do need to know that. That doesn't mean that it doesn't. It means that the research is not clear. So we do have really clear evidence that exercising is helpful. We do not have evidence that eating in a particular way is helpful to treatment.
Okay, good to know. And thank you for clarifying that. But well, I have to say, it's a lot to take in. And I'm sure that you've had to through the years, and I'm so proud of you, because through the years I bet there's been a lot of naysayers perhaps through the times of this research, or have you been welcomed with open arms, or through the years that people say no, that can't be accurate and you just have to keep piling on the research?
So the funniest conversations I had were right at the beginning when I was first doing this work and first talking about this work, and I was at the University of Minnesota. And I went to Doug Yee, who is now head of that cancer center, and said, I'd like to do this work in breast cancer. And he said, great, let's write a grant. We wrote it to the Susan Komen Foundation. We got the grant. Well, I saw right away that there were opportunities in colon cancer. So I went to the colon cancer group at the University of Minnesota, and I said, I'd like to do this with your patients. And they looked at me like I had lobsters crawling out of my ears. So, they were no, we're not going to let you do that with our patients. So it's been interesting to watch how this happens. And I think that there are different cultures that are more interested in this kind of innovation than others. one of the stories I love to tell about that is my visit to Israel, and how, they had a national program that is an exercise oncology program that, is better than anything that I've seen in any other country. And they did it very early on. They adopted very early on, and they're actually doing exercise sessions with chemotherapy patients just before they get hooked up to their chemotherapy. So, I mean, how innovative, really, there are pockets, there are places where amazing things are happening in exercise oncology. We just need to make it so that, one of my frustrations based on what I just said to you a moment ago is that nearly every cancer center has a nutritionist. They don't have an exercise training. And yet we know that exercise is useful during cancer treatment. So let's fix that.
Let's fix that. Okay. I'm on board, and we'll talk more. As I said, I'll reach out to you because anything I can do, I'm passionate about this. So anything I can do to help spread the word. And on that note, I'm gonna say goodbye. I'll do my wrap up, but I'll mention all the websites, the book, where you can get it all. We're going to have it all in the close and in the liner notes. So just that people can get a hold, can find you, not necessarily call you. We're not giving the phone number, but find you, find your book, find everything that you're doing, and become an advocate, or just learn more about the process, especially people who are going through or have had a diagnosis recently. So I thank you. I thank you for all your work. Can you sign off by you don't have to do the long version, but for the audience out there listening and watching, when Kathryn came on, she's her before being a doctor, she was a dancer and was into fitness in the 80s. And guess whose videos she kind of looked at a little bit. So
yes, so I'm on my third career, and my first career was as a professional classical dancer. I was a Graham dancer in my youth in New York City. And I was tired of being poor, and so got into fitness training back in the late 1980s. And as I was learning how to be a fitness trainer, I was really, interested in, really, as much excellence as I could find, and what was the highest bar that I could reach for. And the highest bar I could reach for was Kathy Smith. Watch your videos endlessly. I listened to how you cued. I paid attention to your warmth in those videos and how human you were with everyone, and how I felt like I was in the room with you. And I wanted people to have that experience with me when I was a fitness trainer. I modeled my work after you, and
you are such a doll. That was such a great story. Okay, well, we'll end on that. My heart is filled for many different reasons, but thank you for being on the show. It was such a pleasure having Dr. Kathryn Schmitz on the show. To close it out, I'd like to read a portion of Kathryn's book, just a paragraph that really touched me. And basically, it says this: most likely you or someone you know has experienced a cancer diagnosis. You're familiar, and again, familiar. It was such a pleasure having Dr. Kathryn Schmitz on the show. She was just so fabulous. To close out the show, I'd like to read to you a little paragraph from her book that really touched me. It says, most likely you or someone you know has experienced a cancer diagnosis. You're familiar, at least on some level, with just how difficult, often devastating the news can be. And my hope is that by hearing the stories of my wife, Sarah, and other people throughout the book, that you're going to be able to take away one central message about this experience. Expect the unexpected. Your journey through cancer treatment will almost certainly not follow the path that you expect it to. But one of the things we know for certain is that exercise is proven to help throughout the entire process, from before you first begin your first treatment, until well into your years as a cancer survivor. So if you go to Kathryn's website, movingthroughcancer.com, click on the top tab that says resources, you're going to find a variety of very helpful information. She lists out her favorite tracking devices, her trusted resources when it comes to sleep and nutrition, as well as exercises she suggests for those moving through cancer. Okay, I hope you enjoyed the show. I enjoyed being here. Now, believe it or not, in our last episode, we celebrated 100 podcasts. I can't believe we made it to 100. These podcasts are great to listen to, as I've always said, while you're walking, because you walk, I talk, which is a great combination, or listen to them when you're doing the dishes or driving. You get to learn so many great things from all the great doctors and scientists and fitness professionals around the world. So there's lots of episodes in the archives. Check them out. And if you like them, leave a review and also type in other topics you're interested in. It always helps me as I'm selecting guests. And so until our next episode, here's to your health. Cheers. Bye-bye.